Well, a very important study that was presented by Salomon Monnier from the International French Myeloma Group was a study in which they tried to omit dexamethasone. Well, I think that's very important because patients do suffer from side effects from dexamethasone, and in this study they investigated and compared daratumumab in combination with lenalidomide versus lenalidomide in combination with dexamethasone. It was in a very old population. 60% of the patients were over 80 years, and all the patients were frail, although they used the simplified frailty index. So when you would have used the gold standard, it would have been a little bit less frail, but also intermediate fit patients included. But they found that DARA in combination with lenalidomide resulted in superior response. The responses were higher and deeper as compared with lenalidomide and dexamethasone. Now, important of course was whether the side effects would be less. Well, that was not the case for heme toxicity. That was higher with daratumumab and lenalidomide, but feasible, and you could support that. The infectious rate was comparable between the two arms, and there was a trend for lower pneumonias in the patients who were treated without dexamethasone. So I think it's an important study showing that we could find ways to investigate regimens without dexamethasone, and it actually builds upon the study of Alessandra La Rocca, who already showed that it could be omitted after 9 cycles of therapy. Now, well, we have to await longer follow-up with also the median progression-free survival, some more detailed data on the toxicity, and maybe you should actually compare DARA-Len-Dex with DARA-Len. That would be the best comparison. But this is a first important step for patients to be treated Dex-free, and that would be an important step. Well, now everyone here would have told about the very good effects of the bispecifics and the CAR T cells. But we will have patients now with a high unmet need for other treatment because they will have been exposed to the bispecific therapies and to the CAR T cell therapies. And it was an important abstract in which they show the effect of modakafusp, and that's a totally different drug. Actually, it is an antibody which is recognizing CD38 like daratumumab, but it's differently built because interferon alpha is being attached to it. So via this antibody, you bring interferon alpha to the plasma cells, and it will kill the plasma cells. But a very important effect of the interferon alpha is that it will stimulate the immune cells around the plasma cells, and these are, by example, the natural killer cells. Now, what they found in this study is that in very heavily pretreated patients, already 7 lines of therapy, 50% of the patients were already being treated with CAR T cells and with bispecific antibodies. So actually there was no treatment for them anymore. And then they were treated with modakafusp, so they call it MODA. And so what they saw is that there were a high overall response rate for more than 40%. It was irrespective of whether you were treated with DARA or not in previous lines. When you look to the patients who were not exposed to CAR T cells and bispecifics, the overall response rate was even 60%, which is very high in such a situation. But in the patients who were already treated with bispecifics and the CAR T cell therapy, the overall response rate was still 30%. And the duration of response was long. It was almost reaching, out of my head, I think approximately 12 months. And the median progression-free survival was 6 months. Well, that sounds short, but for this treated patients who were so heavily pre-treated, that's a very good signal. And they're now looking on how they can combine this drug, by example, with the monoclonal antibodies, because we found in the lab, and that was also presented on a poster, that when you give this drug, that then actually the NK cells are being activated, and NK cells are needed for the effect of daratumumab, of elotuzumab. So probably the combination will be very effective, and that will be investigated in the coming time, and hopefully that will change the perspectives for patients who are heavily pretreated.